Hello, I'm Dr. Renee Young of Young Naturopathic Center for Wellness in Los Gatos, California. We're here today to talk about Vo2Max. So Vo2Max is a test that we do at our clinic in Los Gatos where a person will do both an active and a passive portion of their test wearing an oxygen mask. Why would you put an oxygen mask on your face for a test? Vo2Max is measuring how much oxygen you can take into your lungs compared to how much CO2 or carbon dioxide that you breathe out. So as we breathe oxygen in, our mitochondria and our cells are able to form ATP or energy and respire better. So what this test does in both a passive state, while you sit down and relax, we measure for 10 minutes how you're breathing. Your breath tells us a lot about your metabolism. So the more oxygenation we have and the more carbon dioxide we get out shows a better respiratory exchange ratio. So RER, or respiratory exchange ratio, is what's truly being measured. If you wanted to totally geek out, you guys could look online and see this is actually a formula of the volume of O2 divided by the volume of CO2. In an active state, we show not just what you're breathing, but how well you're using your oxygenation. So this is what sets a marker, an indicator called your Vo2Max. Vo2Max is set by age. So if I have someone come in that's 25 versus someone that's 85, I would expect their Vo2Max to change. So Vo2Max declines over time. If you're looking to compare yourself to your peers from an exercise standpoint, that is what the biological age portion of the Vo2Max test is. So what can we learn from this information? We can learn how old you are. We can learn what your macros should be, so the comparison of your protein compared to your carbohydrates and your fat, and also what types of exercise you should do. I know this seems super cool, it really is. So when I have patients come to see me and they ask me, what should I eat? How should I exercise? Boom, immediately, what am I thinking of? Vo2Max. Why would you not want to know, for you specifically, how your cells are respiring? So I'm gonna break this down a little more for you guys from a scientific standpoint. In your cells, your mitochondria replicate your DNA. They do that by zippering and unzippering your chromosomes. And when they do that, certain genes will turn on and off, and energy is needed to replicate these cells. Cellular respiration is needed for replication of your DNA. I know that those are a lot of our words close together that sound really similar, but we're gonna get it here. So think about it like a zipper. You unzipper your DNA, and then to make new ones, we zipper up and create another strand of DNA on the sides. So this zippering and unzippering involves something called methylation. Methylation is what people talk about with biological age from a DNA methylation. So there are other tests that will look at this as well. Your respiratory exchange ratio is looking at how well you metabolize, and they are making an assumption or presumption of what your biological age will be based on that. When we're younger, we more efficiently zipper and unzipper. And as we get older, that gets to be a little bit of a harder function. Oxygen in and then CO2 out in an efficient way gives you a respiratory exchange ratio of 0.7. The lower the number, the more efficiently you're burning fuel. At 0.7, you're burning through the fat that you've stored on your belly and in your butt that you don't want anymore. And at a respiratory exchange ratio of 1.0, you are burning what comes into your body, so your carbohydrates. So your fuel efficiency is what we're really looking at here. Someone who burns at 1.0 will have macros where we'll ask you to eat a little bit more protein because your body needs a more thermogenic fuel source. Protein burns at a hotter rate. It's almost like burning a hotter fire. So we can tell that just like oxygen feeds fire, oxygen feeds your cells. So we can tell if you have a low respiratory exchange ratio, you will generally need a pretty balanced diet in terms of the percentage of protein versus carbs versus fat. The higher your respiratory exchange ratio is, the more protein that you need, potentially the slightly lower carbohydrate diet that you might need. So when a patient asks us what to eat from a macro standpoint, this particular test that we use in our office will provide you with a 15 to 20 page report that goes over exactly what you should eat from a macro standpoint. The particular company that we use will even provide you, based on your Vo2Max, with a nutritional plan. Isn't that so cool? Because you wonder, say you're a person that needs 25% protein. What does that mean? How many calories you burn in a day is what we start out with. So say you burn 1,500 calories in a day, and I tell you that you need 20% of your calories need to be in protein. So I know that you need approximately 300 calories of it in protein. So then if we divide 300 calories by 4, because it's 4 calories per gram, that would give you the number of grams per day that you would need of protein. So we can literally break it down based on your respiratory exchange ratio. It gets cooler. I know you can't believe it's gonna get cooler. It actually does. So then from that, I can also tell you whether or not you should do more resistance training, more cardio training, or more interval training. And you'll also be provided with a report that tells you how to work out. How cool is this? How do you eat? How do you work out? Suddenly, Vo2Max is not just for athletes. It's actually for people like you and like myself that really just want to optimize their overall health. Super cool information for us to get for you guys. Let's talk about how the biological age of an RER test compares to methylated DNA. There are particular companies that we have in our repertoire of tools, of ways we can test you, that test for methylated DNA. Methylated DNA is a very different test. It's a blood test, not a breath test, on how old you are from a biological standpoint. This can be helpful, particularly if you've had an injury, or if you're asthmatic, or you have some type of respiratory condition like asthma or emphysema, to get how well your cells are actually working. We'll sometimes do both a Vo2Max test and a methylated DNA test so that we can tell you from a genetic standpoint and overall methylation standpoint, how are your cells respiring, as well as how good is your oxygenation. So biological age from RER has to do with exercise, and it has to do with overall where your age is from that perspective. Then if we look at methylated DNA for you, we can really see from a genomics or an epigenomic standpoint how you're aging. The third way of checking aging is through telomeres. So telomeres are the length of the ends of your cells. I feel like this is getting to be a more dated way to look at our overall biological age. So we generally don't do it anymore as a test in our office because the methylated DNA and your Vo2Max are such better indicators. How young can we be these days? I think that with our current advances in medicine and longevity, we can take your Vo2Max and you can easily be 20% younger than your chronological age. And we see this in our clinic often. Someone might come in and they might be 50 years old chronologically, but their Vo2Max shows that they're actually 60. So what do? We implement all those cool macros I told you about. We give them the right exercise program, and we spend somewhere between 3 and 6 months helping to amplify their respiratory exchange ratio's ability to burn at a faster rate. So we bring down their RER, and then we repeat their measurement. On average, our clients that are doing things like optimizing their hormones with us, they're utilizing IV therapy, they're utilizing hyperbaric oxygen therapy. All of those things are ways that we can get their RER down so we know that their metabolism is working more like a 25-year-old, less like a 75-year-old. No offense to my 75-year-old. Some of you guys have amazing metabolisms, but we know over time that degrades. So Vo2Max is talking about your metabolic health. So if you're a person that's interested in your metabolism and understanding how do I metabolically work, how well am I aging based on exercise, which by the way, you have control of, which is such a cool thing. We don't have control of our genetics, but you have control over how you eat and how you move. So this is the test that you want to figure out if all of the effort that you have in the gym and in your kitchen is actually paying off. I can't tell you how many people that have come in 10 years older than they are and are now 10 years younger than they are. They've literally had a 20-year swing just by correcting their own cellular metabolism. Really interesting stuff. We often give specials to new patients. If you haven't gotten your Vo2Max yet in our office, please let us know. We would be so happy to help you out with that. It's a pretty simple test. We need to spend about an hour with you in the clinic. Plan on that from a timing standpoint. You need to show up wearing comfortable clothes that you can work out in, including shoes. I know a lot of you have pretty shoes. Please leave them home and bring a pair of sneakers because you will be on an exercise bike for 10 minutes. You'll come in and meet with one of our absolutely lovely practitioners that are certified in performing Vo2Max testing, and they'll get you started, and then you'll review the test either with someone in our clinic or one of our amazing off-site Vo2Max specialists. And with this information, we'll often compare it to some of your other functional medicine tests. So functional medicine tests like a NutriEval can sometimes show us how the Krebs acid cycle or the cycle in your body that makes ATP or energy is functioning. So we'll take your Vo2Max and we'll compare it to your blood work and see, does this match up? Are you burning carbohydrates efficiently? Are you burning protein efficiently? What nutrients and other things can we combine to that to improve your respiratory exchange ratio, improve your Vo2Max? So this is really a really cool whole package way of start with Vo2Max, do some blood work, make some changes, see the results, and be your most amazing self. We can't wait to see you in the clinic for this test, guys, and as always, thanks for listening.